What's up, Des Moines? Doc Ladd here with the Fit Des Moines podcast. Today I have Sydney Moore with Happy at Home Consulting. Sydney, how are you?
I'm good. How are you?
I'm doing well. Thank you so much for taking time out of your day to be here.
Yeah, no problem.
Yeah, so let's go ahead and get started. Why don't you tell us a little bit about yourself and what's your background and what you're doing now?
Sure. So I graduated from Drake University here in Des Moines with my Doctorate of Occupational Therapy. And I worked for a little bit full time as a occupational therapist in a traditional setting. And I realized that there was kind of this area that wasn't being serviced. There was just this gap in care for older adults. So then I founded Happy at Home Consulting in hopes to kind of bridge the gap and provide services to older adults in their homes.
Okay, so now does the consulting business itself provide those services, or do you just work with other groups to provide services for older adults?
So a little bit of both. I kind of have my business set up in two different tracks. So one of those being our own services and providing Medicare Part B services. So we do bill through Medicare. And then the other is more of that consultation, just being someone that organizations can call if they would like any sort of OT opinion. I do some subcontracting and yeah, just kind of help connect community members.
Gotcha. When did this get started?
I just started this organization in March of 2020.
Oh, wow.
Yeah, quite the time to start a business. But this was an idea back when I was in grad school, so back in December of 2018. And it crossed my mind, and I was like, nope, I'm not graduated. I can't do it. Starting a business is really hard,
Yeah,
and I'm not going to do it. And I think it was just working in a traditional setting and realizing what a gap there was to fill. And I was like, oh, I can do this.
sure. What type of setting did you work in previously?
So I was in a continuing care retirement community. So they had outpatient services, they had their independent and assisted living residents, and then long-term care and skilled care. So folks that are coming from the hospital and having a short rehab stay before they return home.
Okay. So is this population uh, something you knew you always wanted to work with?
Yeah, I have always had a passion for aging adults. Was a huge Nana's girl growing up. There was one year that it felt like I was going to her house a couple times a month and staying for the entire weekend. Like as soon as I was off work on Friday, I was on the way to her house, which was like a 2-hour drive at that point, and would stay for the entire weekend. And we would just, hang out together and enjoy each other's company.
That's awesome. So kind of walk us through like what it's like to work with you guys and how you get started and what the process looks like.
Yeah, so for my patients that we're billing Medicare for, the process is a little bit more involved just because of the federal regulations and kind of the different hoops that we have to jump through. So the first step is getting a referral from your physician. And most physicians that I've worked with are really happy to have additional services for their patients. So it's really not a big deal to get started. They just need some order that says OT to eval and treat. And then from there, I set up an appointment with them for the evaluation. I walk through several different pieces, the home environment, physical capabilities, cognitive capabilities, and psychosocial components. OT has some pretty deep roots in mental health and just the idea that when we are participating in our preferred activities, the things that we want to do, we are happier, which no duh.
Yeah.
uh, Everybody wants to be able to do what they want to do, right? So I do include that in my evaluation, and from there I get them set up for a plan of care. So identifying any sort of needs that they have, if they need some safety awareness education, if we need to review like cognitive compensatory strategies, if we need to work on some strengthening, some balance, any sort of like activities of daily living, those pieces. So that's pretty much it for my Medicare folks. For my consulting piece and more of that like preventative wellness, it's much more relaxed. Call me, set up an appointment. We kind of talk about what you're needing. If you're needing just like a one and done, I can happily walk through your home, provide recommendations and go from there. Otherwise, if you're running more like preventative and wellness services, I can meet with you weekly, monthly, whatever works best for the person.
Okay. Could you explain a little bit about, or the differences between occupational therapy and physical therapy?
Sure, sure. So there are a lot of similarities between the two professions. And I think in a lot of settings, OTs and PTs butt heads. And I'm not sure why that is because we both have a place. And I really rely on my PT colleagues a lot, especially when it comes to overall strengthening and balance and the really musculoskeletal pieces of a person.
Yeah.
So for OT, I look at the different, like performance skills. So the different capabilities of person and how that relates to what they're able or not able to do. So if your balance is, changing how you can shower, if you're not able to stand in the shower, we're going to work on your balance and your strength, of course, so you can be able to do that if it's more of like an endurance piece.
Mhm.
Uh, but we're also going to talk about how to kind of meet that need and still be able to shower independently while you're working on those things. So whether it's like adding some grab bars or adding a shower chair, making it so you can still safely and independently complete the task, but also working on what's preventing you from completing the task.
Gotcha. Yeah, I've been a physical therapist for 6 years now, and before I owned my own business, worked it was an outpatient clinic, but there were both places they were inside of a hospital, and just getting referrals from the physicians, it was always funny because usually it's like PT and OT, like they don't really know. It's just like one of you will take care of it. Like we're just gonna put them both on there, and someone will fix this person.
Completely fine. I actually prefer when I have PT and OT, and I feel like it kind of completes the circle of care. Um, it just helps to have both sets of eyes because we both think of different things most of the time,
Yeah,
uh, especially for aging adults who have generally a little bit more complex case and more things going on than just one.
sure. Yeah, yeah, yeah. It's super. It can be very helpful to have a different set of eyes, just a different perspective on it, and like you touched on earlier too. Like I actually didn't realize until past couple years that OT had that mental health side to it, like that. I don't know why. I guess the OTs I worked with never talked about that. So
Yeah, some OTs I think fit it in within their everyday practice.
yeah,
But then there, of course, are OTs that work solely in mental health.
yeah,
If you're talking about like inpatient mental health, there are OTs that are generally working with that patient population too. As far as aging adults, we're seeing more of a mental health component, especially with quarantine.
oh sure,
As we're seeing that decreased social participation, decreased initiation, and kind of drive to participate in activities because what's the purpose,
yeah,
right?
yeah,
Um, we're seeing a lot of depression and anxiety regarding the quarantine and just when's it going to end?
right,
How is the rest of my life going to look? That was probably one of the most challenging phrases that I had to um, hear from one of my clients who he was in his like mid 90s and he's like, well, I mean, I'm not going to be around forever. So is the rest of my life going to be spent in quarantine?
yeah,
Is it always going to be this way? So as far as like the psychosocial pieces, we're working not only on validating those thoughts and saying, well, that's like an actual concern, but also what are we going to do about it? Can we work on calling your family more often? You have an iPhone. Do you know how to FaceTime?
yeah,
Um, when I, when he showed me his phone, it wasn't even working. Yeah, I know. Oh no, because that's just like such a big component to being able to contact your family.
yeah,
Uh, and it just required like a reset, like something super easy, but there wasn't anyone else there to do that for him.
sure,
So OT can seem very basic in some of those mental health pieces, but so important at the same time.
yeah, absolutely, I agree. Now, are all of your services in person, or do you do any like telehealth services or anything like that?
Yeah, so I do both. in the Des Moines area, I definitely prefer my services to be in person if possible, because it is pretty easy for me to travel places. But if we're talking like more rural parts of Iowa where, the telehealth is a better option if people don't want extra people in their home during COVID, of course, I'm happy to do telehealth. My electronic medical record system actually has a telehealth platform built in. So as far as getting people up and running, it's a quick link, it's HIPAA compliant, all that good stuff. The tricky part is just the federal regulations and if Medicare will continue to pay for telehealth or not. That's up in the air.
Right. Yeah. So we've talked about PT and OT. What other services do you guys work with?
I work really closely with case managers. So it's usually social workers that are working with clients who maybe don't have family locally or have family that aren't very knowledgeable about like the medical aspect of things as far as care planning. I work really closely with them as far as getting people set up for success in their home. Because being placed in a nursing home was already a fear really before COVID. A lot of people have adverse feelings toward nursing homes and long-term care settings. But now with COVID and COVID kind of running rampant in those facilities, that's really increased people's desire to stay at home.
Yeah. And do you guys work with any like home health nurses or?
Yes and no. So we're a little bit different from home health. So home health, of course, is billed under Medicare Part A. So you do have to be homebound. So that means that you can only go out for like doctor's appointments, hair appointments, and church. And then we're billing Medicare Part B. So it's essentially the same billing as an outpatient clinic. So if you were to go out into a clinic in the community, but I'm just coming to their home instead. So we can't bill both Medicare parts at the same time. So I don't have a lot of overlap with those nursing staff from home health.
Okay.
But I do work pretty closely with like private caregivers if they're hired through like Home Instead or Senior Helpers or whatever company they're using.
Gotcha. Okay, that makes sense.
Yeah.
There's a lot that goes into that Medicare world.
So much. There's so much.
Yeah. Yeah.
Definitely a learning curve.
Oh, I'm sure. Do you do all the billing yourself then?
Yes and no. So I do have a clearinghouse and people who send it to Medicare for me who kind of double check.
Yeah. I mean, if I were going to bill, I would do the same thing. There's just so many ins, especially with Medicare, and it's changing. There's so many ins and outs of it that it can be really confusing. So.
Yes, exactly. So it's nice to have someone to double check and make sure everything's
Yeah.
good.
Absolutely. So tell us just like how did your interest in health and fitness and everything get started?
I think that it really started when I started volunteering with an individual when I was an undergrad. He had paraplegia, so he was wheelchair bound, and he really had this desire to stay well and stay active. And I think that's probably why I went more of the OT route, is because it was participating in all of the preferred activities that he wanted to do and building up his capabilities to be able to do those things. So I ended up changing my major like my first year in school from biology to kinesiology with a emphasis on community and public health. And from there, I just really fell in love with the field. I mean, there's just so much to do in public health and so many different areas that people can improve their health and wellness.
Mm.
Not just fitness for me. It's not just nutrition. It's the mental health component. It's the financial component. Financial well-being is a huge piece too. The work-life balance component. There's just a lot to look at and help people to, be more well.
Yeah.
Yeah.
Absolutely. Who would you say are some of your big influencers?
As far as like professional or personal?
Both.
Both. Okay. So, the reason I started all of this is mostly from my Nana. She had some significant diagnoses come up later in her life. She did end up being hospitalized, going through like the home health system, and was doing okay, but there was definitely some like cognitive pieces there. And just some overall well-being issues going on. So we really struggled with that. I wasn't quite old enough to be able to really participate, but in her care, but I definitely worked with my dad and then his twin sisters to provide insight as I was going through OT school. So one of the big things is that when she was receiving home health, she had such a decline in mental health because she would go out to the senior site and play cards and eat lunch every day, Monday through Friday, with her friends.
Yeah.
So when you add in that home health piece, they can't go places. They can't receive services and go places at the same time. So she was no longer able to do that. And being independent, she didn't live with anyone. It was just her. All of her kids lived 2 hours away, if not a few more minutes. It takes such a toll on disrupting your daily routines. And that's where I really saw that need for services is to be able to provide people the services that they need without disrupting their lives. Right.
Yeah.
When I was younger, when I was in high school, actually, I had a week off of spring break or something, and I had called her on a Thursday, and I was like, hey, can I come down and stay with you this weekend? And she said, oh yeah, sure, that's fine. I'd love to have you. We'll just do all these things. And I got there and she was like, okay, so I realized that I have this thing to go to, and I want to go to this thing at the church, and I want to do this other thing. And she was kind of subtly saying I'm sorry, I don't have time for you. I have a life to live and things to do. And I said, that's fine. I mean, I'll go. And I called the hospital. I was like, hey, can I do some shadowing? I need these hours. Can I work with you guys? And I did. So that was just a really good reminder that, older adults do have lives. They do have things going on. They have, preferred activities. And that's mostly the reason for Happy at Home, is just to help people continue to do what they love.
Yeah.
Right. In a safe and independent manner.
For sure. Yeah, no, that's a great story. I mean, just like you talked about, and I think we're learning with quarantine and the whole pandemic itself, but that social aspect of just everyday life is super important, and something we're not getting as much of nowadays. I mean, things are opening up a little bit now in Iowa, but we even saw that just walking around. There's tons of people out walking around, and we go around the neighborhoods, and there's people that are sitting out in their driveways, and everyone wanted to talk. And it was kind of funny because there's people we've never seen before, and all suddenly they're sitting out in the driveway in their chairs, and everyone's super happy. Do you know why, or do you have any insight on why Medicare requires that homebound status, and why? I mean, obviously the mental health component is a huge part of it. So why don't they open it up so people can go other places but still receive that care?
I don't know exactly why. I guess my insight would be that when you're receiving home health, they're wanting to pay for a skilled service because you are medically in need of that service, right? So most of the time, people that are receiving home health are recently discharged from the hospital or skilled care, and they truly believe that when you are receiving home health, it's because you can't go anywhere.
Yeah.
Or if you are capable of going anywhere, why wouldn't you just go to outpatient? Because I'm assuming that with the addition of services, because home health is usually nursing, bath aid, OT, PT, speech if they need it. So there's a lot of professions involved, and I'm sure that comes with a hefty price tag.
Yeah,
so
sure.
People are to drive to an outpatient clinic or go elsewhere for services. They see that as maybe a cost saving.
Yeah. Yeah, I mean, I can definitely see that, and for sure it could get super expensive. But it just seems like there's a gap with the mental health side of it.
Yes, I would completely agree with that.
Yeah. Okay. Let's move on here. So, how do you stay healthy? What's your training program look like? Nutrition, just things like that.
Yeah. So as far as training, nutrition, all that jazz, definitely something I'm working on personally too. Has been completely impacted by quarantine. We do have a gym membership. We were going very consistently. It was so good. And then obviously with COVID, that's not a possibility. And even though, the gym is open, I just don't quite feel comfortable putting myself in situations that could improve my risk to be infected.
Well, especially when you're going into people's homes who could be compromised and,
And I still do go into like assisted living communities and more of that like senior living communities for work as well. So
yeah,
I would hate for something like that to happen.
yeah,
So as far as, being home and trying to stay well, it's been quite the adventure.
yeah.
My fiance is maybe a little sad that I'm an OT and I can kind of, not design workouts, but kind of say, okay, we're going to do this and then we're going to do this and then we're going to, and it doesn't take a lot of planning. It's just kind of a spontaneous, like, oh, we're going to go do a driveway workout now.
Yeah.
And there were several times that he was like, it's 2 days later and I'm still so sore. So that's kind of what our routine looks like. We do have dogs, so if we can walk them, get them to the dog park, walk around, and socially distance that way, that's awesome too. Unfortunately, one of our dogs has severe arthritis, so he's not quite a dog park candidate anymore.
Yeah. What kind of dogs do you have?
So we have 4 dogs.
Oh, wow.
2 of us, yes. So we have 2 French bulldogs and a Boston Terrier and a mutt, a large mutt. And that's arthritis. I think he's 9 now. So he has some different things going on, but it's okay. His OT has got it.
Now, a little bit off topic. So you have your doctorate degree. Are all OT programs at that doctorate level now? When I was in school, they were kind of heading that way. I think Creighton was like the first school to actually officially do it. I haven't paid attention to it though.
Yeah, so it's a little bit of a mixed bag still. We haven't fully transitioned to the doctorate. As far as the programs go, there are far more doctorate programs now than there were.
Yeah.
That's just from the standards and accreditation. They were really looking at the doctorate closely,
Sure.
and also looking at occupational therapy assistants and increasing their education requirements.
Yeah.
Unfortunately, in Iowa, that would really change our access to occupational therapy practitioners because all of the those OT assistant programs are in community colleges. I think like 3 out of 4 are. So they really help to cover those rural areas. Sorry, my dog is snoring. I hope that doesn't record very loudly. But anyway, so they really help to cover those more rural areas of Iowa. Yeah. So if we change those all to a 4-year degree, that would, I think, really impact how many OTAs we had.
Sure.
But then as far as like the master's and doctorate, so master's is still considered the entry level that is accepted, but there are a lot of doctoral programs. So doctoral programs are going to be more for folks who are wanting to go into academia and teach. They're wanting to do research. They're wanting to be in administration, more of those leadership roles.
Gotcha. Is that something you want to get into someday, or?
Yeah, so I am on faculty at Indian Hills, which is an OTA program. Cool. So I do adjunct there, and I helped out with some of their student rotations over the summer and taught a class there this summer.
Yeah.
Otherwise, I'm just kind of there to help as needed.
Yeah.
Yeah, and then as far as like administration goes and research, I love both of those pieces. I'm not sure if I could do them full time though. But I think that's also why this like owning my own business is working out well, is because I can factor all of those into what I do every day anyway.
Yeah, it gives you that flexibility, right? You kind of pick and choose your schedule and do what you truly like to do.
Yeah, so I can collect data and I can put together research and really show the benefits of what I'm doing. And then also like get my feet wet and all the admin stuff.
Yeah, for sure.
Your regulations.
Yeah. Let's go to some Spitfire questions. So what are you best at, and then what do you struggle with?
Ooh. I think I'm best at meeting people where they are and seeing the potential.
Okay.
I really like getting to know people. I like getting to know like what makes their wheels turn, what they really enjoy doing,
Yeah.
and um, kind of taking that a step further and finding out like, well, what could make that better? Like, what could make you more involved in that? That would be so awesome.
Yeah.
And I really love coming up with new ideas and kind of taking people to the next level, I guess. Um, the caveat with that is sometimes they get too excited and maybe push people to where they don't want to go, they don't want to get that involved,
Yeah.
or too overwhelming for them. Uh, I have several people on my list to bother about making websites and getting their own blogs going and all that jazz too. So,
Yeah.
uh, it's just one of those things that I'm really excited about this idea. I really want you to get on board too, but ultimately, like, not everyone has like the time or the energy to do that.
Right. So you're a pusher. You push them out of their comfort zones.
Yeah, sure.
That's a good thing. That's not a bad thing. So what would you say is the number one thing that people should do to maintain their health and fitness?
So I'm a huge proponent of addressing the environment. Obviously, as an OT, I really like looking at the home and how your home is either supporting or hindering your function and your safety in the home. So looking at some of those fall risks, do you have throw rugs down? Are they secured? Could they be removed? Do you have grab bars? Do we have seating that is what I call the just right height? So is it easy to get on and off of?
Yeah.
Um, the toilet, the recliner, the couch, wherever you're sitting. Does it have sturdy armrests? Is it mobile? Does it swivel? Those are huge fall risks. Things like that, that I really just want people to consider their environment more frequently when they're addressing how safe they are in their home.
Okay. Are there any books that you're reading right now, or do you have any book recommendations for people?
Oh gosh, I have a whole slew of books, but I will tell you, I'm not good at reading and attending just to one. As far as my book selection right now, I have a lot of business books because, of course, I'm not trained in business. So I'm really working on educating myself as I continue to work on my business. The one I just finished was E-Myth, which is a really great read for any entrepreneur.
Yeah,
And
I've read that one.
yeah, and just talking about kind of getting your bases covered right from the get-go. That's a really good read. And then I have a couple others that are in the stack. I did download this wonderful app. It's called Hoopla,
Oh yeah.
Hopla,
Yep.
and that's a really great resource for people who are wanting ebooks. You hook it up with your library, and you can download so many free ebooks a month.
Yeah. Yeah. We live in Grimes, and I think the Grimes Library uses that as well.
Yeah. So that's a really great resource because I think that was one of the things that I struggled with was I don't want to buy books, especially if I don't commit to reading them,
Yeah.
and, and getting to the library, and most libraries are closed right now.
Yeah. Do you prefer hard copy versus the audiobooks, or?
I think I really prefer the ebook format. I like being able to like adjust the lighting and the backlighting and
Oh,
all.
sure.
And then I don't have books piled up everywhere either because we live in a very small rental house, so
Yeah.
storage is very limited.
Yeah. What do you use? Do you use like a Kindle or iPad, or?
Yeah, I use an iPad.
Gotcha. Cool. What is there anything else that you would like people to know about you or about Happy at Home Consulting?
Gosh, I really designed my organization to have the flexibility to be a good community resource. So regardless if people use my paid services or not, I really want people to be able to reach out to me and say like, hey, what do you think about this? Or have you heard of this program and what are your thoughts? I really want to connect people to existing community resources, people like you or other PTs, and just be able to refer people to where they need to be.
Yeah,
Uh, so even if they don't need my services because in OT world they're doing fine, um, finding those other things that put other areas of wellness that they could improve on and referring appropriately.
sure.
Yeah.
So, Sydney, if people want to learn more about you and about your business, how can they do so?
Yeah, so I have a website. It's happyathomeconsulting.com. And then you can find me on Facebook and Instagram. You can also email me at Sydney, SYDNEY, at happyathomeconsulting.com.
Awesome. We'll be sure to put those in the show notes.
Awesome. Wonderful.
All right, Sydney, this has been great. Thank you so much for coming on.
Yeah, thank you for having me.
No
Have a good
problem.
day.
You too.